So this is an example of a textbook normal neck. Here we see a beautiful curve that goes from back to front and then to back again. We call this a lordotic curve. The spacing between every bone is nice and healthy. The head sits up over the top of the shoulder nicely, and the bones have nice rounded corners to show that there's no degeneration or arthritis starting. This is an example of what we call a kyphotic cervical curve. Rather than coming at the bottom and swinging forward, this neck actually protrudes back and curves the wrong direction. This puts a lot of irregular pressure from the top of the head pressing straight down through the body of the bone versus putting pressure in the back where we want it. The back of the bones is where we want the weight to be because the back of the bones are able to compress and spring easier than the front of the bones. And over time we start to see some degeneration like we see in these two bones here. The front of the bone becomes a little bit caved in, and we start to see some sharp corners forming. When we have this posture of a forward head, it adds a lot of muscle tension and can cause a lot of inflammation, leading to chronic headaches, migraines, neck pain and tension, and even tension across the shoulders and down into the middle of the back. So the most common cause for a reverse cervical curve is going to be poor posture while sitting at your desk at work, poor sleeping habits, an injury like a car accident or whiplash injury, or looking down at your cell phone